Hi, everyone. So, I want to talk about the difference between healing and treating. It's such a major difference, and if one doesn't understand that, you may be not doing exactly what's right for your health, actually. So, healing is obviously making whole. That's why it's called healing, healing a person. Treating is treating a condition, and usually it means symptomatic treatment because people come to a doctor with symptoms and the doctor basically treats the symptoms rather than the problem, rather than the illness. Whereas other doctors approach it kind of from a completely different point of view. They don't actually treat the symptoms, but they treat the problem. And the problem is complex and works on many different dimensions and matter, energy, information, and body, emotions, mind, spirit. So it makes it much more complicated to deal with the whole person. Much easier just to deal with the symptom. If you've got pain, let's take a pain pill. It's that easy. If you've got cancer, then let's remove the cancer. Nobody really pays too much attention to the underlying problem. And I mean, cancer is what I call an endpoint diagnosis. So you don't treat the endpoint. It's like a motor car. You fix a part that's broken, you don't do a tune-up, and you don't check how the driver's driving and things like that. You're not really dealing with the whole problem. You're just fixing the part that's broken and send the driver out again. So if you only deal with the cancer, or you only deal with even the broken bone, and just set the bone. Don't make inquiries. How did this happen? Maybe there's something else you should be doing. One needs to have a look. I mean, maybe the bone is thin. Maybe there's something else going on. So one needs to always look at the bigger picture. And that's what healing the person is about, rather than just treating a condition. So can they work together? I mean, of course they can. I mean, what's called integrative medicine tries to deal with the whole area. I mean, sometimes there's no question about it. People do need symptomatic treatment, and there's nothing wrong with symptomatic treatment, although one needs to know what you're doing. So, yeah, you can treat the symptoms with drugs, but then we need to look at the whole person again and look at their diet, their attitude towards what's going on in their life, the exercise, their sleep patterns. All these kinds of things have to do with healing. So it's not just a question of doing only healing or only treating. It can definitely work together. And you need to know who you're dealing with. I mean, if you go to a specialist is very narrow-minded. They're only they're only good at knowing what they're good at. If they're a specialist, a heart specialist, then they deal with the heart, and they don't look at the whole person. So, yeah, so one needs to know the person that you're dealing with, the practitioner that you're dealing with, the condition that you really want to manage. So it's not, be careful of just symptomatic treatment. I mean, today I saw a man he's had bowel surgery for Crohn's disease. He went to his doctor because his appetite wasn't good, and the doctor gave him a PPI. PPI is a proton pump inhibitor, which blocks stomach acid. I guess the GP that gave him the proton pump inhibitor gave it to him because he thought maybe he had a gastritis, inflammation in the stomach. And so let's block the acid in the stomach. Well, the patient didn't really have any symptoms of it. So anyway, it's just what doctors do. Let's try a PPI inhibitor and see how it works. If his appetite come back, it didn't make much difference to his appetite. And now he was on a PPI that is serious because it blocks stomach acid secretion. And stomach acid is the body's first defense line. There's enough acid in the stomach to kill bacteria, viruses, parasites. You can kill anything. It's amazing to me that the stomach can secrete such high acid content. and still be able to protect itself from the acid as well. So just blocking stomach acid, hell, that doesn't seem like good medicine to me. When you when you block in the stomach acid and you're not allowed first defense of the body, stomach acid, very important defense system. So there are ways that integrative doctors can work with even symptoms, what seem like symptoms, and you think, oh, it's also symptomatic. Like let's take acupuncture, for example. I mean, I've seen astonishing results with acupuncture in my practice. I mean, even with severe back pain, for example, you can put needles in, and 20 minutes take those needles out, and the back pain is gone. I've seen it so many times. So is that symptomatic medicine? Because the pain is gone? You see, it's not like that. Acupuncture it is not symptomatic treatment, even though the pain can go away so dramatically. What acupuncture does is working on a deeper level, on the energetic level, and sometimes, remember, energy travels fast. When you work on the energy level, you can get sometimes very rapid results, which is very different to taking a pain pill. Because if you take a pain pill, the pain may go away for a few hours and then come back again because you're not treating the underlying problem, whereas acupuncture is working with the underlying problem. And so you can do one treatment, and often this immediate pain relief. It comes back after a day or two. Do a second treatment. It goes away now for a few days. You do a third treatment, and the pain doesn't come back anymore. That's called healing the problem. You don't have to keep doing acupuncture for weeks and weeks and weeks and weeks. So symptomatic medicine is symptomatic medicine. It treats the symptom, doesn't treat the underlying problem, and why it's so important. So I'm not saying never to use pain medication. All I'm saying is, check with your doctor. Maybe your doctor can do something very quick, like acupuncture, or using low-energy lasers, which can also remove pain dramatically. But there again, it's not symptomatic treatment. It works by improving health. It works by healing. Have a good day.